So now we go to the sixth presentation. We have again Rebecca Jimenez from the Technical University of Madrid with a presentation called Distribute and Synchronize Users Profile Management for Ambient Assisted Living Services. Thank you.
Now this work I will present on behalf of my colleague Alberto Esteban, but the truth is I also work in this project. It is within the Oasis project, which was presented previously by Esteban. And the issue now is about the distributed and synchronized user profile management for ambient assisted living. We are going to focus now on the health monitoring system of the Oasis project. So our motivation for this work, or for Oasis project in general, was that the aging process involves several biological and physiological changes that may influence older persons' abilities to perform their daily tasks. So it becomes for them a bit more difficult to perform the tasks that they usually used to do. And this is something that is being addressed in a lot of researches, lots of projects, because we all know that the elderly population is increasing nowadays, and from now to several years, a lot of people, especially in Spain, will be elderly, if we consider elderly from the age of 55 years old. So it is a must, I think, to address these the needs of the people, so that we help them to live at their homes independently and not needing to have the help of their relatives or caregivers, or avoiding them to go every week to see the clinicians, the clinic, so that they measure their health status. So the idea is to let them stay at home the longer time possible. So what we want to achieve with the Oasis health monitoring system is to improve the elderly's people's quality of life by something apparently easy, which is facilitating them to control their daily health status. So not to put all the effort in the decision, but to let the elderly people to control personally their health status. So this system aims at providing, when we talk about controlling the health status, the thing is that elderly people tend to have some chronic conditions because just of their age. Most of them are healthy, but they tend to have some chronic problems related to their health, such as hypertension or diabetes or respiration problems, these kind of things. So what we want to do is to help them to control this status by staying at home and not going to the hospital every day. So the innovation of this system is that we are not going to provide only monitorization of the vital signs, but also to provide them with information, education, to put them in contact with other people that are suffering the same problems, and to avoid them to feel loneliness. And of course, alerting and assisting the emergency center in case there is an emergency. So we want to provide all the services to the elderly, and of course, to get information from their vital signs and from their psychology, what they are thinking, how they are feeling, to send all this information according to their permission, of course, to their physicians. So they are in contact every day with their physician. They can ask the physician some questions. The physician can change the treatment recommendation for the user. So they keep in contact. It's a telecare system. And also the innovation within Oasis is that Oasis platform aims at providing lots of different services in the different aspects of the elderly daily lives to the user. So, for example, as Hector was talking about, they have the nutritional advisor. There is also an activity coach application, an application to control the domotics in the home, a lot of services that are related to the different aspects of the user. So, this paper is focusing on how the profile of the user is managed so that other information from different services are exchanged, and so that, for example, this health monitoring system usefulness is increased. And let me explain myself. For example, we want to not only create a health profile of the user, but we want also to include in this health profile information about the daily nutrition of the user. So what we are going to do is to take information from the nutritional profile, from the nutritional advisor Hector, that Hector developed. We want to include this information in our health profile. And we want to give this information to the physician. Okay? So the physician will not only know that, the user is their heart rate is increasing, but they will know that that's because the user is running in a very sunny day and they just ate whatever. I mean, to mix all the information and to give this integrated piece of information to the physician. And we think that it has a strong potential because this extends the knowledge that the physician has of the user and how the user acts in his daily life and how they can treat the user specifically. So, traditional teleassistance care systems, they usually don't operate operate in a non-continuous way. They have asynchronous transfer methods for the information of the user to the clinic, and normally they are not really personalized. I mean, you can have lots of sensors, but each sensor is from a different technology, and what we want to provide in this Oasis health monitoring system is an integrated solution with different sensors and all of them connected to the same platform, to the same system, and give data to the doctor. So going into detail in the Oasis profiling, of course, a health profile is developed for each specific user, and this allows the system to be more effective, to personalize all the services that are offered to the elderly, and the safety of the user is increased by detecting in advance possible risky situations and alerting the relatives or the caregivers that need to know that the elderly is in danger. The health profile that has been defined has a lot of fields, including general demographic information, of course the basic data of the user, the name, the age, the phone, the contact person, in case of emergency, the reference doctor, hospital, etc. Also, it contains general health information about the user's health and the past interventions, some information that is usually contained in general health profiles that we all know when we go to the doctor and they ask us about our medical history. And there are also some treatment recommendations and measurements, and I will explain it later. So the idea is that not only the profile of the elderly is at first created by the doctor, but some aspects can also be updated by the user and also automatically by the system. So, for example, if the health condition, and this is this part of the profile, for example, if the doctor writes down in the profile that the health condition of the user changed, meaning that he writes, for example, that the patient has diabetes, the system will automatically change some recommended measurements for the user. This was done through a study at the first stage of the project. We studied the most common diseases or chronic conditions that the elderly users suffer, and we studied also which vital signs are recommended to be measured from the user when they have this condition. So not only which vital signs exactly, but also the frequency of measurements. For example, if the user has diabetes, he should measure his blood glucose every 10 times, I don't really know, but 10 times daily for 3 months, and then they have to go to the hospital again. I don't know, I'm just inventing things, but the thing is that if the doctor changes the health condition of the user, the system will be able to automatically readapt the health profile of the user to recommend him to take these measurements. This also happened with the medication. I mean, the medication is set by the doctor, of course, so he introduces this data into the medical profile, and the system will trigger the user to take his medication accordingly. And finally, some biomedical parameters that have to be taken, of course, through sensors, and the system triggers this control from the user. So the sensors, 6 sensors have been selected. 3 of them, which are on the top, are non-commercial sensors. They have been developed by Fraunhofer Institute in Germany. So they are prototypes, and the ones on the bottom are commercial sensors. We are capable to measure the activity of the user, the ECG, the oxygen saturation, blood pressure, the blood glucose, and the weight of the user. So as I said, these are the commercial sensors. These sensors send all of them are connected to the system through Bluetooth technology. So these 3 sensors send the value after that the measurement is taken, and the 3 prototypes take continuous measurements take values continuously and send the same time to the system the data. This oxygen saturation sensor is a special case because it takes lots of measurements every second. I don't remember the number, but it had to be treated in a different way, specifically with a specific protocol to get a meaningful value, significant value. So the thing is that the system triggers the user to take these measurements when they have been recommended by the doctor, and which we did, and it is contained also in the profile. We provide different ranges for each measurement of the user. This is something that have default values automatically by the system, but of course can be changed by the doctor for each user, so the personalization is achieved. So there are different ranges, and there is the normal range, which is the safe situation, the range to be controlled, which is a possible risky situation that has to be taken into account for later measurements, the urgent situation, which is a risky situation and somebody should check this value, somebody from the medical center, and finally the emergency, which needs immediate reaction from the medical center, from the doctor. So how is all this information of the profile managed? It can be explicitly or implicitly managed. Explicitly by the doctor or by the user, they can edit the different fields in the profile, and implicitly because, as I said, the system has the power to automatically readapt some of the properties of the profile. And of course, when a measurement is taken, the value obtained from the sensor is introduced in the profile. So this is also something implicitly done. This method applied to handle the profile information enables adequate reading and writing and prevents simultaneous writing in one profile property, because this profile is being managed by different modules, different PCs, from the doctor, from the elderly, from the server. So the protocol that has been applied, of the method, wants to assure that the profile is always up to date and it is real-time assist, so it enables to control properties changes. In order to communicate all this information on the profiles and the different nodes of the system, the elderly, the doctor, web services have been selected to ensure communication security and synchronization between the local profile and the user's device and the remote one in the profile service. So basically, these are the different modules of the profiling system. There is one on the elderly's PC, the elderly terminal. There is one on the physician's PC, and there is the server, which has the profile web service. All these nodes, all these modules, have a copy of the profile in XML files. This is this was decided in the context of the Oasis project to treat the profiles as XML file with this structure that you can see in those tables. With the one at the top is the schema of the single property structure, and the one on the bottom is the single property structure. So with the property name, the timestamp that enables the synchronization, the type of the value stored, and the property value. The profile web service is the system's core. It is located in a server, and this is the module that enables the synchronization. Okay, so whenever the profile manager in the elderly's PC or the web service staff in the physician's PC wants to manage the profile, they download a local copy from the profile web service. They work with that local copy, and then they upload them again to the profile web service. So it controls the adequate reading and writing, and this ensures that properties are always up to date. The profile manager is a bundle, which is an OSI bundle, which is the architecture that has been selected for the elderly's module in our Oasis project. It is, as I said, located in the elderly personal computer, and it listens to the changes in the profile with a specific listener. And this listener follows an actuation protocol. So the protocol is the following. I don't know if you can see very well. The issue is kind of simple. I mean, when a new value has to be processed, it checks which is whether it is different from the stored value. If it's different, then the value is going to be processed. So it checks which kind of property is that, and is the health condition, a biomedical measurement of a medication, and depending on the type of property, different actions are taken. For example, the health condition, they set new measurements, as I explained before, that are recommended for the user to be taken. If it is a medication, the system will send a notification with the new value to the user. And if it is a biomedical measurement, they check which is the range of the value of the parameter, and depending on the range, they will set an alert to the user, to the relative, to the medical center, to the physician, depending on the urgency of response. Finally, this profile web services tab is the one located in the physician's PC. Also, as the other ones, it allows reading and writing properties of the user profile. And using this service, the physician can notify changes in the medication, change recommended measurements, or they receive alerts from the vitals and measurements of the elderly. So after all this development, what I can say is that this development has been carried out following always the concept has followed a user-centered approach. So from the very beginning, we have been working with elderly people to ask them what they want to health monitoring system to be like, what functionalities are expected from a health monitoring system. And from the very beginning that we interviewed a lot of elderly people to the end of the development. I am not going to show you now the interface of the system, because this paper focuses only on the implementation of the protocol. But the thing is that we have taken into account all along the process the opinion of the elderly people. So we think it is a solid tool for controlling the health status of the elderly. The stored information is always valid and up to date. It is not a synchronized product, but a real assessment, real-time assessment. The network problems that may arise causing reception errors have been tried to be solved through synchronized time fields within the user profiles. And finally, adequate reading and writing and real-time assessment of properties changes have been performed. So I think this is the last one. Yes? If you have any question, I can answer.
Thank you very much. Any question from the audience? Please begin there.
I guess that we have been talking in this project and other about profiling and the importance of profiling, but at the end, every project or every initiative talks about their own profile. I mean, do you consider that OHM can be a standard for this user profile? Or do you know, I'm not aware about any standard for user profiling? Because I mean, and this is something that, okay, all of us have that in mind, that this user profile should consider psychological issues, health issues, nutritional issues, but there's no standard, or there's no tool. Or at least it's an ontology, so maybe have to pass with that allows the exchange of information, because at the end the profile will be more accurate as much as more information we have, especially from different sources or from people with different interests.
Yeah, the thing is that we are very aware that standardization is a very important thing, because as you say, all this, there are lots of systems that are focused nowadays on personalization. So standardization is something that has of course need to be addressed. In fact, Oasis project has a specific task for standardization. So everything that is being developed in Oasis is trying to be readapted to follow the different standards, or to get standards from the systems that have been developed within the project. So this is an effort that is being made inside the project. The truth is, specifically for this Oasis health monitoring system, from the very beginning, we studied lots of different systems of different projects, and we, since this functionality of the system was an integration of different functionalities of different systems, because it tries to integrate the education, the information, the contact with others, like social network. So it integrated different things that we weren't able to find a standard that enabled us to give all this functionality. So we don't follow a specific standard, but we are aware that there are different standards for different fields of an electronic health record. So I think it should be a next step of this work to readapt how the fields are called, how the fields are treated, following a specific standard. But the thing is that we didn't find a system that integrates all of this and that we could follow.
But at the end, there's a standard that can...
Yeah, you have standards, or you have more than standards, you have different... Sorry?
Recommendations, I mean, or...
Yeah, of how to... there are different rules of how to name the different fields of an electronic health record. But we always found some lack, or some gaps in these things, and that's why we finally didn't follow any. But we do have standards to name the different diseases, for example, or how they are treated, or so we would need, of course, to readapt some parts of the system to follow standardization, because if not, we are always talking, in Oasis especially, we are always talking about interoperability with other systems, with existing service and that, and it is true that if we don't follow any standard, this will be nonsense to us.
No, let me understand, it's not a critic to the project. You can provide the output, especially for health issues. I worked on the network project where the patient summary report that is a kind of a standard for the exchange of information, but it's only for health status, I mean, it's where we qualify for diseases, diagnosis, and so on, and that's fine. But when we are dealing with elderly, that is a broader concept. So maybe this is a good output from Oasis, just to try to produce
to standardize
the basis for that standard.
Yeah, and actually an effort is being made within the project for standardization purposes.
Yeah, thank you.
Any other question? Okay, so I will. I was a bit in line to what Vicente was saying, but my question will be more linked to if you have had any problems or any discussion about the potential ethics and kind of political problems of one of the things of distributed system dealing with health is who is owning the responsibility and the sharing of the care, and how if we are putting together different data coming from different sources, how we manage who is able to access or use this information, even if it's for the benefit of the patient. When you have multiple users and multiple applications inputting and outputting data from a profile, there is always a big ethical question mark. Have you had any discussion about that, or any problem that you can in the project, or is a further step?
No, well, actually it's a big issue because, of course, when you ask people if they would like to use the system, they are worried about who is going to see this information and how is going to be treated. But we have not managed this issue inside specifically the health monitoring system, but it's being treated inside the Oasis platform, let's say. So that not only the health information, but the information from any application that is being used in Oasis are going to be treated in a secure manner. There is a security framework that is being developed so that data privacy is assured. But of course, our further step, for a real implementation of the system, or real testing of the system, for a real deployment, we suggest different standards that should be followed to assure that the privacy of the data.
So, if there is no further questions, so thank you very much.